All right, today we're diving into a heart medication well, it's kind of like a sniper rifle, not a shotgun. It's called Ivabradine, and its precision is really changing the game for how doctors treat certain heart conditions. So let's get into it.
So just think about this for a second. What if a drug could be designed to do just one thing and one thing only? Slow down your heart's rhythm without messing with your blood pressure or how hard your heart actually pumps? Well, that incredibly precise action, that's the entire story of Ivabradine. So what does that even mean, a pure heart rate reducer? To really get why this is such a big deal in cardiology, we kind of have to compare it to the old guard, the medications that have been around for a while.
Okay, so think of it like this. Your traditional beta blockers are like a Swiss Army knife. Yeah, they lower your heart rate, but they also lower your blood pressure and reduce the force of the heart's pump, all at the same time. Ivabradine, though, is like a surgeon's scalpel. Its only job is to slow the heart down. That's it, and that level of precision is exactly what makes it so incredibly useful.
So how on earth does it pull off that kind of precision? Well, the secret is in this really fascinating mechanism that involves something with a great name, the funny current. Let's take a look at how this all works. First up, you have to meet the heart's own little metronome. It's called the sinoatrial node, or just the SA node for short. Think of it like the drummer in a band, right? It sets the beat for every single heartbeat. It's what keeps everything in rhythm.
Okay, so inside that SA node, this funny current is basically the electrical signal that tells the pacemaker how fast to go. What Ivabradine does is it steps in and selectively blocks only that current. By doing that, it creates just a tiny little delay between each beat. And the result? A slower, more controlled heart rate. It's really that simple and that incredibly precise.
Now, because this drug is so specific, it's definitely not for every single patient with a heart condition. It's a precision tool, and that means it's only used in very specific situations. So who is it for exactly?
Its first big use is for certain types of chronic heart failure. We're talking about patients whose hearts have a weakened pump, but are still in a normal, steady rhythm. It's just beating way too fast. And for a heart that's already weak, that high rate is just exhausting. So by slowing it down, Ivabradine eases that workload, helps the heart work more efficiently, and can even lower the risk of ending up in the hospital.
So to even be considered, a patient's ejection fraction, which is just a way to measure the heart's pumping strength, has to be at 35% or less. Just to give you some perspective, a healthy heart is usually pumping at over 50%.
And on top of that, their resting heart rate needs to be at least 75 beats per minute. This just makes sure the drug is going only to those people whose hearts are genuinely overworking and could really use a slower, more manageable pace.
The second main use is for something called chronic stable angina. That's the chest pain you get from reduced blood flow to the heart. See, a faster heart needs more oxygen, and if it can't get it, that can trigger an angina attack. By lowering the heart rate, Ivabradine lowers the heart's demand for oxygen. This is a huge deal, especially for patients who can't take beta blockers for whatever reason.
Okay, but a drug with such a targeted action has to have some pretty unique side effects and risks, right? So let's talk about what patients and their doctors need to keep an eye on.
And I have to tell you, this drug has one of the most unusual side effects I've ever heard of in pharmacology. Any guesses what the strangest thing that can happen when you're taking this drug might be?
Believe it or not, it's seeing flashes of light. Yeah, really. Patients sometimes describe them as luminous phenomena. It happens because the drug can actually affect similar channels in the retina of your eye. Now, the good news is it's generally not dangerous, and it often just fades away over time. Pretty weird, huh?
So, besides the light show, the main risk is exactly what you might guess from a drug that slows the heart down, bradycardia, which is just a heart rate that gets too slow. There's also a known risk of developing an irregular heartbeat called atrial fibrillation, and this is exactly why careful monitoring by a doctor is absolutely essential.
And this is really important. There are some situations where this drug is a definite no-go. If a patient's heart rate is already low, say below 60, or if they have super low blood pressure, or if they rely on a pacemaker, this drug is completely off the table. Same thing if they have severe liver disease or have just had a heart attack.
And get this, it's not just other medications you need to worry about. Even something as harmless sounding as grapefruit juice can dangerously spike the levels of Ivabradine in your blood because it messes with how your liver breaks it down. This can really ramp up the risk of serious side effects, so it's a super important interaction to know about.
All right, so we've gone through how it works, who it's for, and what the risks are. So what's the big picture? What are the key things to remember about Ivabradine?
Okay, in a nutshell, Ivabradine is a pure heart rate specialist. It works by blocking that funny current right in the heart's own pacemaker. It is not a go-to drug for everyone. It's a very targeted tool for very specific patients with heart failure or angina. And yep, it comes with that one-of-a-kind visual side effect and absolutely requires careful medical supervision.
At the end of the day, Ivabradine really does fill a special niche. It gives doctors a way to control heart rate without messing with blood pressure or the heart's pumping strength. And for the right patient, that option can be a real lifesaver.
And that kind of leaves us with one last big question to chew on. We've just seen a medication that does one thing and does it with incredible pinpoint precision. So you have to wonder, is this the future? Are these kinds of hyper-targeted specialist drugs the way we're going to treat diseases from now on? Definitely something to think about. Thanks for tuning in.